Calgary Elbow.
Thank you very much, Mr. Speaker. Last spring, I asked the Minister of Health why Alberta lags the country on dementia care. I asked when we would see a provincial dementia strategy and the funding that goes along with it. In June, she promised we would see a strategy in the next couple of weeks. In September, she said it's coming soon. Albertans are still waiting, Mr. Speaker. To the Minister of Health, where is the dementia strategy? When will we see it, and why is it taking so long?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. We know how difficult it can be for families when they themselves or somebody they care about is struggling with dementia or other type of mental condition that impacts their ability to recall, Mr. Speaker. And we know how heartbreaking that is. That's why we're working with our frontline providers as well as with community partners to increase resources. And the dementia strategy is definitely a work in progress. I want to make sure that we get it right, and I will be happy to table it in this House when we do, Mr. Speaker.
Supplemental.
Well, Mr. Speaker, more long-term care beds we know are desperately needed, but that is only one aspect of dementia care. 71% of people with mild or moderate dementia live at home. There are remarkable people working in community to improve the lives of everyone impacted by dementia, and while this work has tremendous meaning, without a provincial strategy, they can only do so much. And these are the people who spent so much of their time providing input into a draft strategy that already exists. Again, to the Minister of Health, you were handed that draft strategy back in the summer of 2015. Why haven't you implemented it? Will you, and when?
Minister of Health.
Thank you very much, Mr. Speaker, and again to the member for the question. I want to make sure that we have all of the right supports in our communities and that we're protecting and strengthening public health care. I hope that's what he believes anyway. Time will tell. Mr. Speaker, it's important that we make sure that we have those resources and that when we have the strategy, it's the right strategy. The department did receive it. They've done some work with the contributors, and they're working to make sure that it has the fulsomeness that we all expect, and I look forward to that being the case and being able to share it in this House in hopefully short order, Mr. Speaker.
Second supplemental.
But with respect, Mr. Speaker, how does the government know what they're doing or why they're doing it if there is no strategy? Albertans are struggling, and the cost of doing nothing is high. People living with dementia can't get the supports they need at home. They have difficulty navigating the system, and their family and caregivers are struggling to support loved ones. Ontario committed $100 million to their dementia strategy and an additional $20 million to improve respite care for unpaid care partners. Again, to the Minister of Health, I will ask one more time, will we ever see a provincial dementia strategy? And if we do, will it come with the funding necessary to have an impact?
The Honourable Minister.
Thank you very much, Mr. Speaker, and to the member again for the question. We definitely have tabled many pieces of finance bills in this House, and it's been interesting to see what the opposition record is when it comes to funding public health care properly, Mr. Speaker. We continue to work with our partners. We continue to make sure that we're protecting health care. We've done a number of initiatives. Alberta Health Services launched last year 811 on the HealthLink number. You can speak to a certified nurse who can help you with accessing these specific resources and so forth, Mr. Speaker. We're supporting the community agencies. We'll continue to do so. And when it comes to budget time, I really hope that members opposite put their money where their mouth is, because absolutely we plan on protecting and strengthening public.
Thank you.